This is Mike Sylvia with New Bedford Guide. We're here at the Zeiterion Theatre, 6:30 start time. We're going to talk about opioids, everyone's not so favorite subject, but something that needs to be discussed. So, who am I here with?
Craig Longo. I'm an emergency physician at St. Luke's and co-founder of Physicians to Prevent Opioid Abuse.
Mike Rocha, cardiologist, Hawthorne Medical Associates, also co-founder of the Physicians to Prevent Opioid Abuse.
So what's going on tonight, Mike?
Yeah, so tonight we're going to have a discussion. It's going to involve many different aspects, both healthcare and our police department and civic leaders and people that have lived experience. So we're really looking for everybody to come out because this is affecting everybody, and we're going to provide information. There's going to be tables set up where people can get information about where to get help. We're going to talk about many different things that relate to both pain management, opioid use, opioid abuse, so where people need resources, and also what to look out for in your family if you think somebody may be struggling with a substance use disorder. And we're very excited to have Chief Cordero joining us this evening to talk on behalf of the Bedford Police Department. And so it's going to be a kind of a 360-degree view of what we can do in our community.
6:30 tonight, Zeiterion Theatre. Come downtown New Bedford on Purchase Street. Everyone knows the Z building. There's a parking garage, plenty of street parking. If that overflows, you got the Elm Street parking garage. Tonight, 6:30, potentially ending at 8 o'clock. Let's talk. So how many people do we have tonight kind of in the discussion phase of it?
So we have about a dozen different speakers kind of from all aspects of this epidemic. We have emergency physicians, specialists, we have law enforcement, we have some of our social workers in the emergency department, and I think more importantly we have people sharing lived experience. People like Nick Correa, who are in active recovery, people like Bill Scannell, whose son unfortunately lost his battle with this epidemic earlier this year, and I think that's a lot of value, I think, for people to hear some of these stories.
It's just a New Bedford thing, right?
No, this is, I think that one of the interesting things when we talk about stigma, for example, a lot of people kind of look at this as being a city problem or a lot of the cities, but this is affecting every community, the suburbs, the cities, so this is really for everybody to come forward on this.
So if you can hear this message and you're within an hour and a half of the Z, come on down. So we're gonna have people who have been affected by abuse, and if you have been, you should come down as well and hear the stories. Come tell your story, come ask questions. We've had this question a few times, so if someone, will there be resources here provided?
Yeah, so there'll be resources, mainly the resource tables, and the people coming will be putting out their information and making it available to make those connections. And also some of the social workers will be talking about ways to get help, so that's going to be very important tonight as well.
So let's talk about PPOA. What is it?
So the Physicians to Prevent Opioid Abuse is a group that Mike and I started a couple of months back in hopes of starting to get physicians involved as an active voice in this problem. I think a lot of times as physicians we kind of get involved in our day-to-day work and we lose the public health aspect and the community aspect of our jobs. I think it's important for people to kind of get out of their offices, get out of their emergency departments and come together and be a physician voice to try to bring the community together. I think, a lot of times New Bedford gets a lot of unfair publicity and gets a reputation for apathy, and I think, tonight is a good night for New Bedford to show the rest of the state and the rest of the country that a community that is struggling with this, like so many others, can come together and really have a voice as a community and work together, healthcare professionals, law enforcement, mental health professionals, and people who have lived experiences to try to bring some solutions to the table.
If you can't make it tonight, you can at least share this video, tell your friends and family, people in the area what's going on tonight. So someone here, Doreen, asked, not able to make it unfortunately, but would be happy if you could answer whether or not you're going to address alternative therapies for pain aside from psych meds, and how you intend to address pain going forward.
Yeah, so that's a good question. It's not going to be the major focus of tonight, but that's something that we really are actually going to look to be doing later in the fall. And so this is really one of the ways that we start the discussion, and actually one of the things that's important is to actually have people come down and ask those questions so we can figure out how we can best address those things. But there's no question that there's been a lot of emphasis on how you can come up with alternative pain management modalities.
So we also have nurses program as well, right? So
Yes.
they're gonna have the nurses prevent opioid abuse as well here.
Yes, they're also going to have a table in the lobby with their information on how people can get involved with them if they want to as well.
That's important. We had an interview yesterday. It's, I believe, over roughly 1,000 nurses that are in the group. How many physicians in the PPOA?
Well, for the originally right now, so we had a letter to the Standard Times that 37 doctors originally signed the letter. There's been more people that have showed interest. On our Facebook group at this point, we have about 1,800 people that are following, and I would encourage people that are looking for other resources to like our page, because honestly, we're trying to actually provide what current information and current issues are surrounding this issue on our Facebook page, and I think that we've had some wonderful discussions there. I've learned a lot from people that have gone ahead and messaged us in terms of what their concerns are, and there's some people that actually said that they're going to be coming down tonight to kind of voice some of their questions and concerns through that. So I think that our social media Facebook group has been very responsive to people's needs.
Yeah, if you type PPOA or Physicians to Prevent, you'll start seeing the group pop up.
Yep.
And the page. Website coming soon. Is this a one-way conversation tonight, or are we having a two-way conversation?
No, this should definitely be a two-way conversation. We want to bring together people from all of these different kind of avenues like we talked about, but there's a lot of value in question and answer, and we want to have time at the end for people to be able to ask their questions and engage all the members of this panel, in a good community discussion. It's important for us to kind of get a community perspective on this, where they think that we can be of service, kind of what they would like to see from law enforcement, healthcare professionals, mental health professionals. So definitely it needs to be a two-way discussion.
What are some of the topics that are actually scheduled for tonight? Like, what are some of the discussion items?
Yeah, so some of the discussion items are going to include talking about the new Charlie Baker laws surrounding opioids, which are really important for people to understand what is actually the rules that physicians are under. And also there's been CDC guidelines that have tried to help improve what we're doing for prescription drug management, for pain management, excuse me. And we're also going to be talking about, what is pain, and we have a pain specialist that's going to be here tonight to talk about pain in different modalities. We have people that we talked about, are going to be talking about their lived experience. Social workers are going to be talking about what the signs of addiction might be and where to get help. And we're going to be talking also about what the police department's role may be in dealing with this issue. And that's, I'm sure we're not going to answer we're not going to get to everything, but I think that this is a great opportunity for us to start that discussion and move forward.
Why is it important to come out tonight and not just fight opioids on the web?
I think people need to become actively engaged. I think it's easy to sit in your house, sit in your office, say it's not me, it's not my kid, it's not my family. This isn't a New Bedford problem. It's not a South Coast problem. This is a national problem. And really, what we're seeing here, this event tonight, there's not a lot of places in the country that are doing anything like this. It's a good opportunity for the community to engage as a whole. Not physicians speaking to physicians or nurses talking to nurses, to get everybody together and start bringing some minds together to talk about how we can confront this as a community. And it's an important event for New Bedford to lead by example.
So it's kind of, I look at, you said over 30 doctors, Mike, it's kind of like an all-star cast. It's not people who are just private practice, it's people in the emergency rooms, it's people on the front lines of this epidemic.
It is, and actually, interestingly, we had a continuing medical education meeting the other day, and there were 80 doctors at the Waterfront Grill to continue that discussion. And we had people that were anesthesiologists, surgeons, primary care doctors, emergency room doctors, subspecialists like cardiologists, and various other subspecialties, pediatricians. And I think that what we have to realize is that we all have to work together. And I do think that this is, in terms of a community physician group, this is certainly the only one that I'm aware of in Massachusetts and probably New England. And I'm not so sure where we stand with the rest of the nation, but we may be one of those first in the nation groups. And I think that, we're standing together with the nurses as really a group of brothers and sisters that need to do something differently, that we oftentimes are taught, pills and procedures, but we need to go beyond that, and we need to realize that coming out and doing this public health work is so important.
Yeah, so we have 1,200 seats or so in the Zeiterion. We want to fill it up. It's important to come out, be active, have an active discussion with some of the doctors. Your police chief, Captain Cadero, New Bedford Police Chief, will be here. and we're gonna have a lot of people down here, and we need you to come down and participate. You can't just change your avatar on Facebook, and that's how you fight opioid abuse. You gotta come out and have a discussion. We want you out here. Coming down, Zeiterion Theatre, 6:30. Try to end around 8, but if there's a lot of people here, we can go further. Is there free stuff here tonight to kind of get people down here? Anyone wanna?
Yep, so there's free t-shirts tonight. And actually I was able to meet with the Surgeon General last week, who was very excited about the work we're doing, because we're using the hashtag turnthetideNB, and I don't think there's a city that it would be more appropriate than where we are. So we'll have t-shirts available. We're also going to have pizza and refreshments beforehand, so if people want to come down and eat, I would encourage people to come a little early, probably 6 o'clock. The doors will be opening, and the actual event is going to start at 6:30.
So pizza, drink, you get nice company, and we get to at least have a discussion about the opioid crisis. So thank you for your time. Come on down, guys.
See you tonight.
See you tonight.